I'm Dr. Jane Wilcox. I'm the Associate Chief of Cardiology here at Northwestern Medicine and the Medical Director for our Center for Heart Failure.
I'm Duc Thinh Pham, cardiac surgeon at Northwestern Medicine and surgical director of the Transplant and Mechanical Assist program.
Our heart transplant program is really designed to make it easy for the referring physician, our partnering physicians, and our patients. We have state-of-the-art procurement techniques. We really keep the patients at the center throughout the entire process. We have coordinators who are available on the phone, so a referring doctor, provider can call us up and say, hey, I think this patient is appropriate for heart transplantation. And our nurses then will get the testing locally. We then bring the patient in for a 1 to 2 day comprehensive evaluation to finish up testing. The patient meets with Dr. Pham or other surgeons, meets with myself, the medical director, or LVAD director, physicians, social work, coordinators, infectious disease. We have this comprehensive kind of full day evaluation, and then we render an opinion for the patient within probably 1 to 2 weeks after that comprehensive evaluation.
For patients who are out of state, we have the capability of reviewing a lot of these testing beforehand and then setting up a virtual visit with the patients. And then when they're ready to come for their full visit, we try to make it as quick and seamless as possible. Once we fully evaluated the patient and decided that transplantation is the best therapy for that patient, he or she is placed on the waiting list. We're able to find the right match for the patient. The surgery itself takes typically about 6 to 12 hours. If everything goes smoothly, the patient is in the intensive care unit for 1 or 2 weeks, and then another week or so in the hospital and hopefully discharged to home and back into the community.
I think referring physicians should expect that we are going to think outside of the box for their patient.
Our main goal is to have the patients out in the community with their friends and family as much as possible. So whether it be partnering up with their referring doctors to stay as healthy as possible while they're waiting for their heart transplantation, or giving them a smooth post-hospital, post-transplant courses, and then quickly back out into the community. Once we have a patient in our care, the commitment to them, their families, as well as the referring is to the very end. Cardiovascular disease is the #1 killer of Americans. And quite frankly, that's the bottom line in that. And it's our mission here at Bluhm Cardiovascular Institute to address that challenge.
When patients are facing these tough decisions and they hear the T word transplant, it is a really tough time for patients and families, and they are looking for a home, they're looking for trust and hope. And that's something that we are very honored and humbled to be able to provide. So I really do think that the patient stories are what fuels our team and what really motivates us to do better always with the next case, help family members, make sure that patient has a good outcome. And each small ripple, each small patient story creates this tide of overwhelming teamwork, and we're so grateful, and we have this team approach that we get to do every day.